So it's live. Can we start?
Yes.
Good afternoon, everyone. I'm Dr. Kirti Soota. Welcome to Facebook live session from Dr. Makkar's Diabetes and Obesity Center. Today we will be discussing about insulin and everything about insulin. Talking about diabetes, diabetes is a chronic condition which affects the way the body processes the blood glucose. Either there is a decreased production of insulin or a resistance to the insulin. And the treatment of type 2 diabetes, it includes diet, exercise, medication, and yes, insulin. As soon as we listen to this word insulin, it gives goosebumps to the patients. So is really insulin so scary? There are a lot of questions which arises in the mind of patients who are suffering from diabetes. So today we are here to clear all your doubts regarding insulin. So welcome to the live show.
Thank you, Dr. Kirti. Good afternoon, everyone connected with us for this Facebook Live.
So my first question to you for the day is, what is insulin?
I'm sure most of the diabetes patients now, with the improving level of education and awareness about disease, understand what is insulin. So insulin is basically a hormone which is secreted from a particular cell type in pancreas, which is the beta cell. And this hormone is involved in regulating the glucose levels in such a manner that glucose levels do not go beyond a certain narrow range during the normal state of metabolism. So what happens is that irrespective of patient, whatever is eaten in terms of food, irrespective of the food that is taken by patient, the glucose levels will keep varying in a normal range, which is considered as normal. And the normal fasting we consider less than 100, and the normal postprandial, that is after meal, is less than 140. So in a normal individual, this hormone is the key regulator of normal blood glucose levels. And there is a continuous secretion of insulin in body, whether it is basal state, that means fasting state, or the fed state after meal. So insulin is not only regulating glucose level in response to meals, it is also maintaining the normal glucose levels during the fasting state. Not only that, the general perception is that insulin is a hormone involved only in glucose regulation or glucose metabolism. But insulin is actually one of the key hormones involved in the whole of metabolic processes that happen in body. It plays important role in fat metabolism. It plays very important role in protein metabolism also. It is an anabolic hormone which keeps your body in the positive, healthy state. So in addition to glucose regulation, it has multiple effects. To maintain normal glucose, yes, insulin is very important.
So we talk about insulin therapy. So when does a person suffering from diabetes, he or she needs insulin as a treatment?
So I think this understanding also has to be, clear. Usually there is no confusion that type 1 diabetes, which is less than 3% and happens in children or young adults, there is no other treatment except insulin, because those people are deficient in insulin, and insulin is a life-saving drug in type 1 diabetes. And most of the people understand this, except off and on we keep getting, videos from people like Ramdev, and there is this gentleman who is Dr. Biswas or something, they are selling videos all the time that we can cure diabetes. So type 1 diabetes, I want to give a very clear message that if you are going off insulin, if you are stopping insulin, it can be life-threatening. Insulin is a life-saving drug for type 1 diabetes patients. There can be a phase in type 1 diabetes patients also where insulin requirement can go down or maybe, zero. There is something called honeymoon phase where person may not require any insulin. But that does not mean that there is any other alternative for type 1 diabetes patients except insulin therapy. So insulin is a life-saving drug, and type 1 diabetes patients should not think of anything else as on current date as a treatment for type 1 diabetes. Now, when we come to type 2 diabetes, most of the time the treatment starts with lifestyle interventions and oral medications. Now, as you initially said, type 2 diabetes is caused by two major defects. One is the deficiency in insulin secretion, which is progressive, which keeps on decline. Insulin secretion keeps on declining with passage of time. And there is resistance to the insulin action. So initial part, why we are able to manage with oral drugs? One, there is not complete deficiency of insulin. There is a insulin reserve which is there. Second, there is resistance to action of insulin. So if we remove this resistance to action of insulin, whatever reserve insulin is there, or the insulin function secretion that is remaining in the body is usually able to cover the requirement for insulin. So there is a variable period where the person can stay on oral drugs. So oral drugs act by two mechanisms. One, improving the insulin secretion in the body, and second, decreasing the insulin resistance or resistance to action of insulin in the body. Either way, they improve the efficiency of insulin. So ultimately, all the drugs that we are using, except one new class of drug, most of the drug, 95% of the time, are acting either by improving insulin efficiency or decreasing resistance to insulin. So ultimately, we are playing with insulin action also, only in type 2 diabetes also, and not just, that pill is not going to do wonder unless it is acting through that insulin axis.
So the question which comes into a mind of patient when we start him or her on insulin is insulin safe?
Insulin is one of the safest drugs. There is no second thought. Only thing is it needs to be used very judiciously, because insulin is one drug or a hormone which needs to be given as of now in the form of injection. But now we have inhaled insulin also available outside India. In India also, I think next year we should be getting inhaled insulin or oral insulin. Now, important thing is that once insulin is given, because of the variable degree of resistance to insulin action, everybody requires a different dose of insulin. So it is not, there is no fixed formula that I give you 1 unit per kg per day for every patient and it will work. So the requirement can vary between 0.5 units per kilogram per day to anything up to 5 units per milligram per kg per day. So somebody might be requiring 20 units, somebody may be requiring even 100 units. Problem is, once we are doing this adjustment, then we have to balance it with the lifestyle and diet. And if person, kind of misses or skips meal or by accident takes extra dose of insulin, there is risk of low sugar, which in any case happen with the oral drugs also. So except this, there is no issue as far as the safety part of insulin is concerned. Insulin is possibly one of the safest drugs to be used in treatment of type 2 diabetes. And in fact, if you look at patients who have type 2 diabetes and pregnancy in women, the only approved drug is insulin, because this is the safest drug which can be used in pregnant women without causing any side effects for the baby.
So on a lighter note, so can I say laughter is the best medicine unless you are a diabetic, because then insulin comes on the list?
Yes.
Sir, how do you decide how much insulin is required by the patient? Like you said, it may be varying from zero point 0.5 to 1 unit per kg. So how do you decide and initiate it?
So there are titration algorithms which are based on the usual standards that we have seen in studies. The usual starting dose in type 1 diabetes and type 2 diabetes is different. The starting dose will also depend on the age of the patient, the overall profile of the patient, the blood glucose levels of the patient, the level of obesity that patient has, how many drugs already has been used on this patient, what is the duration of diabetes. So everything affects the requirement of insulin, right? So it varies, and there is no magic formula that can tell you that you start with 20 units or 30 units. But by and large, the starting dose that we start with is not more than 10 units, unless patient has very high glucose levels or very high level of obesity and we expect a lot of resistance, we may start with higher doses. And second thing is, it needs to be titrated. It needs to be, we need to actually, find out what will be the exact dose for this particular patient by monitoring the glucose levels constantly and seeing the response to insulin on ongoing basis.
So do you give your patients liberty to titrate insulin?
Not on the first visit, but by second or third visit, usually we educate them. We educate them about how this insulin is to be titrated, and we give them little slower titration that I would do myself, because I don't want the patients to get into low blood sugar levels. But I explain to them and I give them a written a formula also on the prescription, that this is how you increase or decrease the dose of insulin in case there is a any change. And most important thing is, I also explain them that if the blood sugar goes low, immediately bring down the dose of insulin. More important concern is that hypoglycemia should not happen. It does not matter whether we are able to control the sugar levels in 2 weeks or 4 weeks. It does not make much difference. But rather than getting the sugar down rapidly and having multiple risk of hypoglycemia, it is preferable not to have hypoglycemia and have a slower titration of insulin.
So there are a lot of barriers which we physicians face while initiating insulin in a patient. Like whenever you talk about insulin or you say that we have to put you on insulin, it's key. My last stage has come now. How will I deal with it? How will I live with it? So how do you deal with all these apprehensions of the patient?
So this is a very common notion that insulin is required to be used at the last stage of disease. And once you offer insulin to the patient, patient will think that no, I think my end is coming or my diabetes is so bad. Actually, if there are quite a few studies which have shown that if you control blood sugar with intensive insulin therapy right from day one of diagnosis, actually you can induce remission of diabetes. After 3 to 6 months of insulin therapy, a lot of patients will not require any therapy for a variable period of few years. And we have seen that in our own practice. So new onset type 2 diabetes patients who are kind of eligible candidates based on certain criteria, if they are offered insulin right in the beginning, it can actually put the diabetes into remission. So insulin is an option which can be started on day one of the diagnosis of type 2 diabetes. Problem is not the insulin. Problem is that it is injectable. So everybody, and second thing is the lot of myths and confusions associated with insulin therapy. So everybody wants to start on oral drugs and nobody wants to start on insulin. Second thing is, even in most of the primary care physicians, the level of skill that is required to monitor and manage insulin is not there. Third, oral pills are easy to use, easy to take, you know, they are easy to handle. There is no issue of injection or cleaning the site and so on. So oral medications in any case offer much more convenience as compared to injectable medication. So because of this, as a policy or as a practice worldwide, the initial medication remains the oral medications. And rightly so, because nobody wants to inject unless you need an injection. And with those medication, we are doing exactly what we are going to do with insulin. We are giving insulin, we are bringing down glucose. With those medications, we are bringing down the resistance to insulin action, improving insulin secretion, still getting the sugar on level. Now, because of this, as the disease progresses, as I mentioned right in the beginning, that loss of insulin function or decrease in insulin secretion is a progressive phenomena which goes on increasing with the passage of time. So you reach a critical point where the insulin production is not sufficient to control the glucose despite all the oral medication. And that is the time when person or patient is offered insulin as a choice or insulin as an option to add. Now, because of this, everybody thinks that insulin is to be added only in the end of disease, or the complications have happened. Certain complications, the insulin becomes a preferred drug. So everybody thinks that unless diabetes has got complicated, or diabetes has become very advanced, or the person has received the end stage, then only insulin is required. The end stage story is also related to one more reason, that most of the people who are on oral drugs do not monitor their sugar levels, and they end up with complications which can be loss of vision, retinopathy, there can be kidney damage, there can be heart disease. And once they get into those complications, they end up in the hospital with sugar levels of 350 or 400. They are offered insulin as the primary therapy. So that also has possibly created basis for the notion that if you need insulin, possibly you are at the end stage or you have a complicated diabetes. But there is no actual basis for this notion or myth. Insulin can be started at day one of diagnosis of diabetes or at any point of time during the course of disease. And of course, it's a very valid option for treatment of type 2 diabetes.
Another important query which arises in the mind of patients suffering with diabetes is, what will happen if I don't take my insulin, if I miss my insulin?
So, if you are on insulin and you miss your dose, your sugar will go up. Next day you take your dose, it will take another 2 days to stabilize. Nothing. It is not that you miss one dose and you will end up in a severe complication. Usually 99% of the time, if you are on oral drugs and insulin combination, it is unlikely to happen. Type 1 diabetes, yes. If you miss even one day insulin therapy, child or person can end up in severe hyperglycemia and diabetic ketoacidosis. So for type 1, it is a life-saving drug, not to be missed on any day. Type 2, you may miss one day, your sugar control will fluctuate, but unlikely that you will have a major complication with missed dose on one particular day.
Another very important question which I personally also face is, the patients ask me, can insulin be stopped once it is started, or once if I am put on insulin, will it be stopped?
It is very important question, and the answer is both yes and no. So what happens is, if somebody has very high glucose levels, these glucose levels suppress the function of pancreatic beta cell, and the whatever insulin reserve is there, that goes lower, it is decreased. So this is called glucose toxicity. The high levels of glucose influence the pancreatic beta cell in a manner that insulin secretion is further decreased. Now you give these patients insulin, you bring down the glucose, the glucotoxicity effect is gone, and the pancreatic beta cell will recover from the toxicity of high level of glucose and will start functioning normally. As a result, the insulin levels will start improving. Now, once they start improving, the dose of insulin required goes on declining, and you can actually stop the insulin and put the patient back on oral medication. Second thing is, there are a lot of situations where we have transient use of insulin. Patient going for surgery, we have to put them on insulin. After the surgery, after the wound has healed, we can easily take them off insulin and put them back on the oral agent. Third thing is, does this happen in every single patient? Now, some patient who has very high glucose levels, we put them on insulin. The glucotoxicity may not be contributing to that much decline in insulin, and the patient has already very compromised beta cell function. So once we take off insulin, the glucose levels will go up again. So some patients who do not have enough reserve will not be able to go off insulin once it is started. There are other patients who have enough reserve, but it had got reduced because of glucose toxicity. They can go back to the oral drugs. And the patients who have used insulin only in the transitory phase, like acute illness, surgery, trauma, those patients, certainly we can switch them back to oral drugs.
Another very important which comes to us is, Doctor, is insulin better or oral agents better?
So there is nothing which is bad or better. As long as we are able to achieve good glucose control, whether we are doing with oral agents or we are doing with insulin, that is the most important factor to be considered as first thing. Now, within oral agents also, we have now drugs which not only improve blood glucose level, they also lead to weight reduction, which is an add-on advantage. They also reduce the risk of heart disease. They also reduce the risk of kidney disease. So they have added advantages. Similarly, insulin, in addition to bringing down glucose control, it brings down the risk of inflammation. It improves immunity. It leads to some weight gain, which is not a big challenge. But if it is being used perioperatively or after surgery, the wound healing is better because the inflammation is lower with insulin. So insulin has its own advantages. The only problem is that people want to stay away from insulin is possibly it is not the fear of insulin, it is the fear of needle. So today only we had a patient. This lady is about 65 or 70 years who came to us for the first time, has been on actually much higher dose of oral agents than it is safe to use. She is getting double dose of the agents in an attempt to bring down glucose, while that dose can damage her kidney and liver also. But since she doesn't want to start insulin, so she has gone on the higher dose. So first thing I had to talk to her was to give insulin. She said, "Doctor, I don't want insulin. Insulin to main nahi loongi." So now what should be done in such a situation? So I told her, it is your choice, but you tell me why you don't want to. No, I am getting, this insulin, I don't want to use. But it is final stage. Doctor, मेरे को नहीं use. So I said, fine. अभी जितना आपकी मेडिकेशन चल रही है, ये आपकी ओवरडोज में है, इसके साइड इफेक्ट्स हैं, तो इसको कम करना जरूरी है. आप इंसुलिन चाहे लो या नहीं लो. दूसरी चीज है, अगर मैं आपको इंसुलिन की गोली दे दूं तो चलेगा? He says, हाँ, I can take tablet. So then I told her, but tablet आती नहीं है इंसुलिन. तो अभी तो आपने कहा आप दे देंगे, मैंने कहा सिर्फ ये समझाने के लिए दिया कि इंसुलिन का आपको डर नहीं है, आपको सुई का डर है. Then I showed her the needle pen, needle size, injection, counseled her. She says, Doctor Saab, can we try for one more week? Otherwise, I will. So I gave her one more week with the modification of insulin oral agents, changed her diet pattern, counseled her. It may take time, but important thing to keep in mind is that it is not fear of insulin. It is the fear of needle. And that needle is now, if we are using a good pen and needle for insulin injection, the needle is only 4 mm and 32 G, which is actually less painful than a mosquito bite. If you check your sugar using a glucometer, it is much more painful than the injection of insulin. So it is the phobia of needle that is causing more problem than the phobia of insulin. And there, I think a lot of counseling and lot of confidence on part of treating physician is important to make patient understand that insulin, once required, there is no substitute. As I mentioned, to begin with, what oral drugs are doing, they are either increasing insulin secretion or they are decreasing the resistance to insulin action. Now, once the insulin reserve has declined to a level that it cannot take care of the glucose levels. Now, even if you remove resistance, there is not sufficient insulin to bring down glucose. So what do you need to do? You have to give insulin from outside. So insulin has the advantage that when nothing else is working, insulin will still work. And it should be initiated as early in the course of disease as possible rather than keeping the patient uncontrolled for long periods of time.
So for this reason, I knew we will be talking about needle phobia. I'm having this pen with me and the needle, if it's visible.
So yeah, so there is shine that comes in between, but actually once you see the needle, it is so thin that it's difficult to see it from a distance. And you have seen, I have done so many demos for patients, for doctors, injecting on myself. I have injected on myself during demos so many times. It is, yeah, and we
Tummy
have
also
educated, educational tools are there. So it is not difficult to make patients understand that insulin therapy, if required, it is the best option, and one should not delay it by a single day if it is required.
Actually, the patients should understand that it's a progressive disease and you may need insulin as a treatment.
Yes, but the important thing is how would patient understand?
So there comes the role of the physician or the treating doctor.
So problem is that in India we do not have the concept of team. Everything is to be done by the treating physician. So physician is physician, he is also dietitian, he is also lab technician, he is also counselor, he is also, everybody wants to talk to physician only for the slightest of problem. So if you have a dietitian who is taking care of nutrition, there is a counselor who is guiding you how to take, needle, use injection or something, give a demo, give a support, option. If patient needs any query, patient can call and get education on that. We can use educational videos. So ultimately, the onus lies with the healthcare providers to provide sufficient education to patients, to make sure that they don't have any kind of wrong notions for use of any oral drugs or the insulin.
It's just like providing the right information to the patient, timely information to the patient. And I think we need to have time also for the patient to do all these things.
So it is important, but patient does not need a lifetime to do this. But people take years to control their sugar. To get educated, it does not require years. if somebody wants to understand diabetes as a patient, what is to be done as a patient, I think 1 or 2 days of focused, education should be more than enough, which can help this patient for the rest of life to manage his diabetes comfortably. But the problem is, because of this, people are uncontrolled for years together, and they do not, get their sugar into control and get into complications. So I think diabetes self-management education, as we call it, DSME, is one of the integral parts of diabetes therapy, and every single diabetes patient needs to be educated about diabetes, the usage of various drugs, do's and don'ts, diet, exercise, everything needs to be, educated.
As a patient, one should say, my pancreas have given up, but I will not.
Yes. No patient should give up. With diabetes, one can live a very much normal life for, the rest of whatever years are there in life. It is not difficult. Only thing is, you have to maintain some amount of discipline, not a difficult thing to do. And in fact, that discipline is required to be maintained by anybody with or without diabetes to stay healthy. If you don't maintain that much discipline, your health is going to be compromised. What are we telling our diabetes patients? You should go for exercise 45 minutes to 1 hour every day. You tell me one person who does not exercise at all and will remain healthy. What do we tell them to eat? Healthy food. Is it bad for anybody? It is good for everybody. It is to be maintained by everybody. If you are overeating, you will get obese. Very good chances. You will end up with other problems. If you smoke, you will end up with cardiac disease. If you drink excessively, you will end up with liver disease. So discipline is required to stay healthy. And that is what discipline is required by diabetes patients. It is not different from a person without diabetes. So I think we have to take away a lot of wrong notions which are there, and make patients understand, make them confident in managing their diabetes.
Actually, sir, in our country, health was never on focus. And from last just 4 to 5 years, we have been focusing on health. Daudega Bharat, health is a priority. So many these
Yes.
campaigns have come up. So I think that is
Plus,
going
social
to create
media
a
has
revolution.
also helped in creating a lot of awareness. At the same time, social media has also created a lot of misinformation. So important thing is to filter the information rightly, to pick up what is right for you, and not to get lured by these false claims of so many people, promising you cure of diabetes or there was a patient recently who asked me, Doctor साहब, वो तो कहते हैं हम क्योर कर देंगे. So I told him, you go and try, and if you are able to get a cure for diabetes, I will give you the list of my patients, and I will write to them that you should contact this person and get it cured. I cannot cure anybody's diabetes. Till date, I have not been able to do. After almost how many, 35, 40 years in diabetes management. And it is not that I have not been able to do. Nobody has been able to do worldwide. In today's date, we are using the same treatments, same strategies as the globally any physician is doing or any best center is doing. Nobody has come up with a claim that we can cure diabetes. Incidentally, this is 100 years of insulin therapy. Insulin came into clinical use, insulin was discovered 100 years back, 1921. And after 100 years of insulin usage, and with almost 10 more drugs on the platter, we are not able to cure diabetes.
Very true, sir. Sir, any other thing you would like to add?
No, I think idea of this discussion was that one should not get scared by the word insulin. Insulin is like any other drug that is used for management of diabetes. And in future, you are going to see more and more drugs which will become as injectables. Because whatever we have been using are, so-called inorganic chemicals, which can be taken as tablet and they still maintain their action. Insulin is a protein. Any protein that you consume will get digested in the stomach. Now we have got technologies which are allowing absorption of protein from stomach without getting, degradation of protein. And in due course of time, we should see insulin also coming as a tablet. Already it is there as inhaler. But till that time, we still need to take this as injection. So it is like any other drug which needs to be injected because orally it is not effective. That is the only difference. And it is a very important drug in the management of diabetes because when everything else fails, insulin still works. So one should not run away from insulin and keep the sugar levels high and end up with complications. It is better to get on insulin faster if your sugars are not controlled and maintain normal glucose levels and avoid complications.
Thank you, sir. Thank you very much.
Thank you, Dr. Kirti. Thank you everyone for joining our Facebook Live and hope to see you again on next Thursday, same time, 3 p.m.
Thank you, everyone.
Thank you.